Mental health, the future of whole health.
Good evening, everyone, and thanks for staying with us for one of the last panels. We understand we are almost standing between you and your drinks, so we'll try to stick with the most important and interesting bits and pieces. Today, we have a stellar panel of people with different backgrounds and various creative insights and ideas to share tonight with us. So, starting from left to right, we have Dr. SAMMUT ALESSI, followed by Dr. Brian Wallace, and last but not least, Dr. RAHIM. Each one of them is going to bring us a little bit in their own world. We'll keep it conversational, and we'll be more than happy if you have any questions or decide to jump in almost at any point. So, without any further ado, my name is Georgi and I'll be the host. Why don't we start with a quick round of introductions, Dr. RAHIM?
Thanks, Georgi. So my name is Ayesha. I'm a practicing psychiatrist, and I am the clinical lead for digital mental health in NHS England, as well as being a chief medical information officer in a provider organisation.
Hi, I'm Dr. Brian Wallace. I'm a physician, neuroscientist.
Take your time, Brian.
Say again?
Take your time.
Okay, I'll get through these words. So, yeah, Brian Wallace, physician, neuroscientist. I'm the chief medical officer and co-founder of a company called Calmsie Therapeutics. And we make therapeutic video games for children with depression and anxiety. We do that by providing games and a video bot that they can interact with on a daily basis in real time. And I'm also the chief medical officer of a company called Neuropositive, and they make personalized music-based interventions that target natural pathways in the body to reduce anxiety and reduce pain. So I am involved in a lot of product development. I'm involved in research development and design and validation.
Steve?
Hi, I'm Steve. I'm a doctor specializing in psychiatry. I've been working in psychiatry for the last 6 years now. And I'm very, very passionate about community psychiatry and how we can focus on encouraging and enabling patients in the community to remain as far out of inpatient services as possible. And I do believe that technology has a very important role in that, especially now that everybody's mobile phone is an extension of their arms. So I do believe that this is something we really need to look into.
Absolutely, and on top of that, we seem to be living in extremely, extremely interesting times. We have changing social perspectives, we have an ongoing war, we are completely stick to our devices, and it seems, digitally wise, we are more connected than ever, and yet lonelier and separated from one another as never before. So with this kind of a grim opener, I would actually like to start with you, and could you maybe lead us into the mental health state in 2023 from your shoes?
So that's a really interesting question, and one of the benefits of working in both a national organisation and as a healthcare provider, I see a whole spectrum of mental health in the UK particularly. But I think one of the first things that's really important to delineate and differentiate between is often when we talk about mental health, we talk about one big thing, when actually, in fact, digital mental health covers the spectrum from the space where the general population is interested in their own mental well-being. They may not be ill, but they're interested in their mental well-being. To the opposite end of the spectrum, where we have inpatient care in secondary care services, and then we have a whole gap in between, don't we, of our community mental health services in secondary care. And I think it's really important to make that distinction, because actually different parts of the pathway lend themselves to different technological solutions. So the space that I occupy is more in the secondary care part of this pathway. So on an inpatient side, things like your electronic patient record and the ease of use of an EPR for a healthcare professional is really important. We've got technologies like vision-based monitoring systems, for example. In the well-being space, we have a lot of self-care and self-guided apps, for example. But really, for my money, the biggest opportunity that we have is in that space in between, in the delivery of community mental health care, because there is lots that we can be doing in this space to really change the field. Because In terms of the mental health landscape generally, and I'm speaking about the NHS in England specifically, although some of these are common globally, we have a workforce crisis. We have demand that is outstripping the resource that is available to deliver that. We have people on waiting lists that are ill enough that they need to be referred to secondary care services, but they don't get an intervention for a very long period of time. So there is lots that we can be doing in this space, which I can talk about later.
Awesome. I'm sure we will come back to the community aspect of things, but before we do so, Steve, what's going on in Malta?
So in Malta, I have noticed that as time has gone by, we have noticed, all of us, that there's a great reduction in stigma. So lots of people are seeking help. In the last couple of years, we have seen a lot of global uncertainty, which influenced Malta, whether it was the COVID era, whether it is now the instability caused because of the war that is ongoing and the instability in the big powers across the globe. And people do seek help. And when they do seek help, they seek help either because of their well-being, as you mentioned, or because of their health, or because of actual mental health disorders which need treatment. In Malta, we're working a lot on the crisis teams and working on crisis resolution home treatment teams, which is something which was recently enabled in the last year. And we're also working as well on community psychiatry as well, focusing the majority of our resources, if possible, to community outpatient services. Because we notice that generally having a good report in the community and saying that the patients comply to medication and understand why they need medication keeps them out of the hospital. The idea now that patients need to be locked away or kept inside, or that is something which is gone now, and it is something that only is used in situations where there is very, very high risk, or where there are psychiatric disorders which require admission. Otherwise, the threshold for admission has gone up considerably, which is something which is, I have noticed even in my lifetime working in psychiatry, noticing a great difference.
And how do you see the role of technology and development coming into this specific aspect?
Well, there are different roles. So what was mentioned so far was even from the administrational aspect, whether it is keeping patient records, whether it is checking and seeing that the patient attends follow-ups with different specialists or multidisciplinary team members, whether it's the occupational therapist, the psychotherapist. You're ensuring that the whole team is on the same page and ensuring that through technology you can keep a follow-up of everything. And the patient is now, more than ever, able to maintain constant contact with their therapist, which before was something which was unheard of. So there's that direct link. At the same time, we have to be careful that we keep in mind that technology can offer this much, but we have to always keep that patient contact and that human contact, because most of these people suffering from mental health problems need that human contact. And that is something that no technology can give, but we can enhance it.
Well, you just passed the ball quite neatly. Brian, is there anything that we can do without a human touch on the other side?
Yeah, I think if you look at the current system or the traditional psychiatric system, many people will say it's broken. I think they've pointed out some really interesting ways that we've advanced it recently. But if you look at it traditionally, this model's not working. We've got an overburdened system. And when we focus on children's mental health, we see that there are a lot of parents that have to watch their child suffer as they wait for an appointment to get screened or diagnosed, and then they wait for another appointment to get therapy, and then follow up to see how the medications are doing. And these could be months apart. So the child can deteriorate during that time without any supervision. And as Steve points out, you can be in constant contact now with your therapist or your psychiatrist through technology, and we call that remote therapeutic monitoring. And so what we specialize in is creating a platform where you can actually engage the patient. You can give them components of CBT, and then you can take them through automated therapy sessions that are non-judgmental, but they're very personalized and they can react to what the patient is saying. A lot of people will say, well, is that generative AI? Generative AI isn't there yet. It's very, very good, but 9 times out of 10, it's awesome. The 10th time, you're going to get sued and shut down. So you need to really put some safeguards on it. So we have scripted, personalized responses that can be used to help the child go through a therapeutic session and then start to apply what they've learned in therapy and what they've learned in the game into their real lives. So that's one thing that we can do with therapy, and that's what we're doing with children's technology. Now, if you look at what we're doing with neuropositive, this takes it a step up and it makes it really personalized, because you can start to look at biomarkers that are being emitted in different, like let's say for example, anxiety. So there are certain biomarkers that you can target to have natural cascades of reactions, and as you target those, then you can start to reduce anxiety. So you're using technology to provide an external stimulus to create an endogenous cascade that can produce some really nice results. And what I focus on is making it engaging, making these apps or these applications or the software as a medical device engaging, because the more engaging they are, the better the outcomes can be, and then the more adoption you get in the clinical setting.
So if I can come in there, Georgi, if that's all right. I mean, I absolutely love what you've just talked about there, Brian, because this is exactly the opportunity that we have in front of us. Now, psychiatry, as we know, mental health has a long history, as many areas of medicine does, of being very paternalistic in how it delivers care. And we are now moving to a position actually where we want to try and empower the person so they can co-produce their own care via things, for example, like the apps that you just mentioned. And in some ways, psychiatry has even further to go, because most countries in the world, let's face it, have legislation that allows us to treat people against their will in the interest of their health, but that is incredibly disempowering. So I think it's incumbent on those of us working in mental health to really go that extra mile in ensuring that the technologies that are available to us are used to go out there and empower people through patient engagement platforms in whatever form they may take.
Yeah, they have to be safe, they have to be effective, and then they have to be engaging so that you can start to improve outcomes. Are you seeing these in practice? Or because I'm in the product development and the validation, and we see a lot of really interesting products go into the hospital, but then they come out of the hospital and nobody adopts them, and it's because they have slightly poor user experiences in many cases. So how do you see adoption in the clinical setting?
I think one of the main challenges that we face, unfortunately, is that we would have to split the patients in two. You'd have those new patients who have no exposure to psychiatric services, and those patients who are of the younger generation who have always known technology. And then you have those patients who unfortunately are used to even the paternalistic view of psychiatry and who have not much experience with technology. So when you have a mixture of both, it's hard to decide and gauge what exactly is going on. You have to try to find exactly the patient which is suitable for the service. Yeah. Introducing such a service is the way forward, but I think these things take a lot of time to implement on the clinical setting. As far as I'm aware, we haven't gone that far yet to apply these digital innovations yet.
Yeah, one of the things that we talk about when we look at my industry as a whole with children's mental health, one of the big arguments is you're taking a technology where children use or spend most of their time and most of their attention when they're not outside playing. They're looking at their screens. And so we're taking traditional therapy and traditional psychiatry, and we're just delivering it in a way that they're familiar with, they're comfortable with, and in a language that they understand. And when you do that, you can really start to engage them, and that's when you can really start to see adoption in the community, adoption by the clinicians as well. I think you have to show outcomes to clinicians. It has to be data-driven, and I think you guys are probably adopting a lot of data-driven products right now.
That's the hope, but sometimes what lets us down is our basic digital systems that are not designed with the clinician's workflow in mind, which makes that really hard. But one of the things I like to do is to zoom out a little bit, because I keep reminding myself it sometimes feels like we're wading through treacle, trying to get adoption, trying to get innovation out there. But we are still in the foothills of digital transformation, right? This stuff takes decades, so we have to start somewhere. So I keep that in mind. It gives me hope.
You mentioned something really interesting. One of the things that when we surveyed, I think about 200 physicians before we introduced the game initially, and they all said, and this was a common theme throughout, we love the idea, we love what it's doing, we love the outcomes. is it going to interfere with my workflows? Because I got a lot of work, and I don't need any more. And that's a big. I'm sure you yeah, I've done paperwork with you. I know it's bad.
I think all over the globe, psychiatrists are unfortunately overloaded with work. So yes, definitely, you have to make sure that it is even user-friendly for the entire all the team, really, to make sure that everyone is able to keep the same workload and not end up even more overloaded.
And I wanted to go back to something that you were saying, Steve, about the way in which we deploy technology, because of course we know that the social determinants of health are really particularly relevant in this area of medicine. So we need to make sure that we are ensuring that the digital transformation that we are doing supplements and adds choice rather than cuts off channels of communication as well. We have that responsibility too, don't we?
So before we overrun, are there any questions? Because we can keep on discussing for a longer time. If anyone wants to raise a point, now is a great moment. 3, 2, okay.
Hi, I'm Dr. Anju Bhargava. I'm a digital health psychologist, and I've worked a lot on mobile apps combining psychology and technology. So for some of the apps that I've worked on, I see that what you're talking about, they're not engaging enough to keep people on them. So what I've seen now is these companies are incorporating some type of peer support or a health coach or some type of therapist. They're not just doing the app on its own, whether it's CBT or a different type of evidence-based therapy. They have to include that human component that you're talking about. So I'm curious about your thoughts on that.
Yeah, one of the things that a lot of people talk to us about when we're pitching the idea, when we're trying to get it into a community hospital, they'll ask if there's a community component to it. And what we find is if you open it up for open discussion, you get a lot of disinformation from one child to the next. So there has to be safeguards. It has to be monitored. I live in a community in London where they had a mental health community for children, and there was so much disinformation there that they had to shut it down. And I think that you really have to put some safeguards in there. But what we do is we try to have interactions. Like you can compare scores that you're doing with the community. You can submit artwork that you're doing within the app, and people can give it a thumbs up, and you can have likes and things like that. So there is that social component to it, but you don't want that direct social interaction at this stage because monitoring it is still manual. And if it's not manual, then some disinformation can go through.
And I think just to add on to that as well, I think you're absolutely right in involving healthcare professionals in that journey, but involving them also means making sure that they are fully trained to do so. A very small, quick anecdote, telemedicine, video consultations, it's not bleeding edge technology, but we had to adopt it wholesale in the NHS in light of COVID. We found a big drop-off, and partly that is staff don't have to do it now, and so if they don't feel confident and competent to offer this as an option, they are not going to offer it to the people that might otherwise say yes. So there is something about how do we support our workforce to deal with this digital transformation revolution that we are seeing at the moment, because if they don't feel comfortable doing it, we're not going to get to the people that need it.
So a rapid fire one with please short answers. Dr. RAHIM, first with you. If you had one wish, a magic wand, what would you do to improve mental health?
More workforce to free them up to think about digital transformation.
Brian, where do you see the biggest leverage from today's standpoint of view? How can we save the global mental health?
Well, I think greater investment in global mental health is going to open up more answers. It's going to open up more opportunities to improve access and delivery of care. And I think that's really what we're doing in this transformation right now is access and delivery.
And on that same note, I think you had a metaphor on the warm-up.
Oh, yeah. I was talking to a VC, and he said, yeah, me and all of my friends have very deep pockets right now, but we've got very short arms. We don't want to invest just yet in this current economic climate. And I think if we had a wish list that the economic tides would turn and there would be a lot more investment in brain capital, as Powell will be talking about tomorrow morning, I'm sure.
So, dear VCs, please grow longer hands. Thank you. And Steve, any last remarks on your end?
I think one of the most important things is that even us that are facing these things and trying to innovate things, we have to try our best to take care of ourselves and try to take care of each other in this system, because sometimes it can be quite competitive. And I think as a take-home message, if there's anyone that's going through a difficult time, it's okay and it's fine. Just look for help. There's help everywhere you look for it. So that's my closing remark.
Awesome. So thank you so much. Thank you, dear audience. Let's wrap it up. Wishing you a great mental health, not only today, but for the rest of this year and hopefully for the rest of your lives. Take care, be well, and yeah, connect with one another. All the best.